Thank you for allowing me to present my Leadership College research project with you. And this project really stems from one of my professional passions, which is the informed patient or patient education. And every year, more and more of our patients really want to have a better understanding of their medical diagnoses. And we want this for them as well. Unfortunately, being able to elevate our patients up on their knowledge level is not an easy task, as we all are too familiar with. But if we are unable to, as a profession, provide this knowledge basis for our patients, they're going to seek this information elsewhere, and sometimes to their detriment of their health. And these last couple of years have been a painful reminder of this phenomenon. We've coined the term med school for our patients, or my education and diagnosis, and our attempts to really bridge this gap and provide a medium to really help educate our patients in a more effective manner. Next. We have to remind ourselves that shared decision-making is a novel concept in the history of medicine. Often we probably forget that historically, in the practice of medicine, most of our patients more or less were passive passengers. As medical providers, we would pilot their plane to their healthcare destination. Our patients were more or less passengers on that flight. They may wake up for a magazine, they may wake up and ask for refreshments, but more or less they were passive passengers, hopeful that their medical providers will land them safely at their healthcare destination. Over the last few decades, though, there's been a paradigm shift. Modern medicine really wants both patients and their providers to be co-pilots in their healthcare profession. But this requires us doing a lot of focused knowledge-based teaching to our patients. And this is definitely difficult. And a lot of providers don't have the means or capability to do so as effectively as they would like. Next. But we know patient-centered care works. The data supports it. The verdict's in. When our patients are educated, when our patients are engaged, next. Data shows that our patients have better outcomes, next. Improved quality, next, as well as decreased cost. It is a win-win-win. When our patients are educated, when they're engaged, the outcomes are much better, their qualities are better, and the cost is way down. And study after study has confirmed this concept for us. Next. But the tough part is to really educate our patients. There is an inverse relationship with the time it's needed to educate our patients and what providers are being asked to do. There are more burdens being placed on providers now with an ever diminishing amount of time. We're being asked to do things so much through our electronic medical records, through documentation, that it really makes it difficult at times to really provide that focus and energy and time it needs to really update our patients. Next. As a result, a lot of our patients go to the internet, unfortunately to Dr. Google, as we are so familiar with. And a lot of research studies recently have confirmed our suspicion when patients do this. Next. A lot of studies have confirmed that there is a high utilization for patients acquiring healthcare information online. Next. Unfortunately, study has confirmed that the vast majority of information our patients find online tends to be inaccurate. Next. Or incomplete. Next. Or does not quite match the health literacy of the bulk of our patients. And this is definitely a difficult dilemma that we're placed in. Next. Because of this, we tend to feel that we're in this perpetual cycle with our patients. If you start at the top photo, most of us in our practice, we try to inform our patients, take that time to really provide information and knowledge base to elevate our patients. But because of the whole multitude of tasks that we're asked to perform on a daily basis, hence the physician juggling and the second picture to the right, our patients often leave our clinic encounters with a little bit less information, a little bit confused. So they go, again, what's even worse than Dr. Google is Dr. Facebook. They'll go to Dr. Facebook, try to find more information, become even more confused when they come back to the appointment. And that provides this perpetual cycle. But what if we can break this cycle? Next. What if we're able to create an interactive medium, which is what we investigated to do, attempted to do, to help our patients better understand their diagnosis and engage in their medical care? Next. If we can do this effectively, then it is a win-win-win. Our patients win because they are more educated, more knowledgeable about their medical diagnosis. Their insurance companies win because cost is decreased. It actually helps the overall cost of their care. And as, of course, providers, we win as well because our patients are doing much better. They have better outcomes. Next. So our practice, we created a pilot investigative program to see if we can accomplish this. Next. We created a series of tiered small group online seminars, very similar to how we all experience in college. We had levels 101, 102, et cetera, to really stratify our patients based on their knowledge basis. Next. We attempted to automize this process. We used our EMR to identify patients that had similar diagnoses over the prior few months, reach out to them and offer invitation to participate. Next. Through each seminar, we would create a didactic seminar that was filled with formal discussion, question answer session, as well as examples. Next. And we particularly wanted to match the interest level knowledge bases of our patients with each tiered seminar. Next. Before and after each session, we would obtain formal questionnaires to obtain feedback on the effectiveness and inquiry of our patients. Next. Our results. So what did we find? Next. As you would imagine, 100% of our participants admitted to using the internet to acquire healthcare information. Next. None of our participants felt fairly confident that the information that they found online was actually accurate. Next. Interestingly, none of our participants actually intentionally discussed the information that they searched online with their provider before and after their formal clinical visit. Next. We did find that before and after the seminar, the percentage of patients that felt they had a better understanding of their diagnosis improved from 40% to 80%. Next. And before and after the seminar, the percentage of patients that felt that these sessions were effective and they would be something that they would be interested in participating in moving forward also went up as well from 60% to 80%. Next. In conclusion, next. Our investigation found that many of our patients wanted to have a improved understanding of their medical diagnoses. Next. Unfortunately, most medical providers may not have sufficient time during their usual workflow day, nor resources to adequately do this to their desire. Next. Interactive small group tiered seminars appear to be an effective adjuvant resource to supplement what we do as medical providers on a day-to-day basis. Next. We want to do further investigation to see how best we can improve this modality and really incorporate it into a normal workflow without adding any undue extra work for our profession. Next. Moving forward, our practice is going to continue this proof of concept to really increase the number of seminars that we can accomplish over the next year. And hopefully we're planning on engaging our insurers to really incentivize this for their patients and their providers in their plan. Next. Thank you.